So pancreatic neuroendocrine tumor, you can divide it into two types. One is functioning and non-functioning. Functioning എന്ന് പറയുമ്പോൾ it is insulinoma. Okay, insulinoma. So insulinoma, you have to remember one triad. Whipple triad. Whipple triad, insulinoma mean what are the things that can occur? Insulin elevated, so hypoglycemia symptoms, blood sugar will fall, symptoms will occur, and when you give glucose, there will be a relief. So that is the triad. Blood sugar will be less than 54. So usually what happens is when it reaches the level of 70, insulin will stop. And hypoglycemia and the counter hormones increase like growth hormone, catecholamines, cortisol, like that. And when it is less than 54, we call it as hypoglycemia. So this is important. Okay. So the pediatric precursor of this tumor is called nesidoblastosis. So you have to know what is the clinical feature. Okay. Hypoglycemia. So just imagine you are fasting. Then you want to always, you have a feeling that you want to eat. So frequent eating. So you are eating and you will gain weight. So in this condition, though you eat something, immediately again glucose fall down, again you eat, so weight gain. So when the glucose fall down, you cannot concentrate on your studies. You feel sleepy, irritability, visual disturbance, sympathetic symptoms gets activated, palpitation, tremor, sweating. So the investigation that you can do here. So this is a hotel. Ramu is going to hotel and having food. And Ramu came outside. Again Ramu have to go for having food. Again come outside. This becomes like, or Ramu mota hua. So the investigation of choice is 72-hour prolonged fasting. So at this stage, intermittently you have to check the blood sugar level, and blood glucose will fall down. As I have told, less than 54. That's hypoglycemia. In this case, it will be much lesser. And the insulin value in the blood, you have to look. Radioimmunoassay, it will be more than 6. Usually normal it is less than 6, but here it will be more than 6. So here insulin levels are high in Ramu, glucose levels are low, and the ratio of insulin by glucose is also high. So normally in insulin it is less than 6, but here it is more than 6 value. Glucose will be low. We know hypo is 54, it will be much lower than this, and this value is high, that is more than 0.3. Usually this value is less than 0.3, normal case. And in insulinoma, more insulin secretion. So insulin is A chain, C chain and B chain, or A chain, C chain and B chain, and the active form has A and B. So A and B will be there, plus C peptide will be, you have the sulfide bond here. C peptide will be separate. So more insulin secretion, more C peptide in the blood. And only when there is increased glucose, diabetic ketoacidosis. So in that condition, you can go for ketoacidosis. Here, ketone bodies, plasma level of beta hydroxybutyrate will be less. So this is actually a tumor in the pancreas. So you can go for ultrasound, or you can go for CT MRI imaging. Another thing is somatostatin receptor scintigraphy. Okay, that's one technique, because somatostatin is there in pancreas, there in pituitary also. So this technique also you can use. So you ask the patient to have frequent small meals, and the treatment is mainly diazoxide. Diazoxide is the treatment. So that is about insulinoma. Insulinoma, you have to know that this is a pancreatic neuroendocrine tumor functioning. Okay, non-functioning is different. It is, example is PPoma. PPoma means, we will discuss later. So Whipple's triad, and you have to know Whipple's triad. Then this is where general information. At when glucose reaches 70, insulin stops, counter hormone production starts, and when it reaches up to the level of 54, that's hypoglycemia, then acidoblastosis. What happens in insulinoma? Blood investigations, treatment. Okay. Now we will discuss about hypoglycemia. So in insulinoma, you get hypoglycemia. So general information I have told you, at 70 that insulin production stops, counter hormone production starts. Hypoglycemia is when it reaches 54. So you can have 3 levels of hypoglycemia. Initially, as I have told, when it reaches 54. So see, generally we say 70 to 110 is the 70 to 110 is the level of, or 70 to 100 is the normal fasting blood sugar. So when it is less than 70 up to 55, okay, that is stage 1. Stage 2 is less than 50, less than 50. So in this stage, you will be very sleepy, lethargic. Here you get seizure in stage 3 seizure, and you may be comatose. So the treatment is dextrose, IV dextrose. So yesterday a patient came to our OPD, and he was having chronic liver disease. Okay, he actually come with the ascites, and by the time of examination he got seizures. So immediately the doctor called the nurse to put an IV dextrose. So that is the treatment. If IV dextrose was not available, you have to go for subcutaneous glucagon. So the conditions that can cause hypoglycemia is not only this insulinoma, it can be chronic kidney disease, chronic liver disease, or pancreatic tumor like insulinoma, or if the patient is on some drugs like insulin, sulfonylurea, malnutrition, alcoholism, all this can also cause hypoglycemia. So that is about hypoglycemia. So a patient, and there was one patient who have told me that when he checked the blood glucose level, it was 60, but he was not having a symptoms at all. So that is actually stage 1. So this is a kind of mild hypoglycemia. We have to make the patient aware. So this is about the pancreatic neuroendocrine tumor. So at this time it is neuroendocrine tumor which is functioning, that is insulinoma.